Hey, welcome back. I'm Neal Petersen. My wife, Darlene, and I have traveled all over the world looking at healthcare in different contexts. Right now, with our issues with the COVID-19, we are really facing a global healthcare crisis of proportions that are really unimaginable. But before we really get to talk about some of these aspects of how can we deal or solve, or what are the information around COVID-19, I just want to relate a few things of my experiences in our travels. So as you may be aware, I like to sail and I've traveled by boat to many places. One of my fellow sailing friends, who also enjoys this luxury of sailing, ended up falling on his boat in Grenada and breaking his ankle. He was taken to the hospital and he was told he was going to need surgery, and he was in a panic mode. He's American and he's in a foreign country. He has no insurance. What is the quality of this surgery going to be? What is the cost of this healthcare bill going to be? He's going to have to put in a credit card. He realized he has to spend 1 or 2 days in hospital. Between the surgery, the hospital stay, and the various things that was associated with the broken ankle, his bill was under $50 US. And he asked if that is a mistake. And he says, no, this is what we are charging patients. And he said, but I am not from Grenada. And he said, no, you're a human being. This is the bill. And that is what he had paid. Darlene and I traveled to India. And in one of our travels, we wanted to do a mammogram and a pap smear for Darlene and a sonogram, so not a sonogram, a MRI for myself, because I have a hip issue. We made an appointment with the hospital. We saw 3 different doctors and spent a few hours getting all of these things done. Firstly, we were able to walk in and get an appointment. We didn't have to schedule this days in advance. And when I was going through my MRI, it was the latest state-of-the-art MRI machine. I got engaging in a conversation with the doctors. They were not just trained in India, they also were trained by the Royal College of Medicine in London. They were of the highest caliber of trained doctors. And then I braced myself. What is the bill for all these 3 things going to cost us? That bill was under $200 for all 3 things. And again, I questioned, is this a special price? Was there something that's substandard? Firstly, I was handed my x-rays, handed my MRI. It was mine to keep. And when I shared it with another doctor, he said, wow, this is good stuff. You're in great condition. So this was nothing that was substandard. This is the cost of some of the healthcare in other countries. We hear these stories in COVID-19 where people go to an American hospital and they are feeling ill. They're going through a few tests and they're panicked because of what could the bill be? How many thousands of dollars can this be? And yes, they are hit with big bills. We don't know how healthcare in the United States is going to be paid for. Healthcare in the United States is not a fundamental basic human right. It is a profit center. It is about insurance companies. It is about hospitals trying to find how do they maximize returns. Doctors are not getting rich in American hospitals. The standards in American hospitals are, I'm not sure, sort of under those pricing, I'm not sure they're getting anything better than in some other country. So we really have to start to look at what is healthcare. How is it looked at in certain parts of the world? How is it looked at in your country? And how are people going to pay for it? The number 1 reason for bankruptcy in the United States is not because people were mismanaging their money or was foolish with how they spent their money. The number 1 reason for bankruptcy in the United States has been because of a health issue and not being able to pay the bill. We have to really understand, what are we up against? We have to come together as a global organization, as a collective of people, and we have to put back our expectations of, is healthcare a basic fundamental human right, or is it a luxury? I think you know what the answer is going to be to that question. And as we look at healthcare, we need to have a very clear, concise understanding that healthcare is built upon science. It is not snake oil. It is not black magic. There is a very strong science protocol And we have to come back and respect the science. We have to be able to trust the science. We have to expect that as we deal with COVID-19, the scientists who are working on understanding this virus, the other scientists who are working on trying to find a vaccine, the other groups who are working on the delivery mechanism of a vaccine, we have to trust that they're going to be the best scientists available, that we're going to have the best brains. We cannot take guesses, because what if we guess wrong? The United States, Sweden, Great Britain have taken one approach to how they want to look at lockdown. South Africa, India, South American countries have taken a different approach of a harsh lockdown system. We don't know who exactly is right. We need our science to tell us what is the right thing. Who are the elements that we have to be able to trust to move forward? We cannot have some leaders saying, drink bleach or take this drug without the proper scientific proof that it's going to work, because people will die. People are dying. Let us not mess around and take a stab at something. Let's get it right. Let's understand what we are up against, because we only have one shot at this called life. We cannot guess on our lives, because what if we guess wrong? Again, I'd like to hear your experiences of what have you dealt with, what have you learned. I heard from a friend of mine in India, because again, Darlene and I have used Ayurvedic medicine as one of the areas to understand mind, body, spirit, and to get down to the root cause. And so in our travels to do Ayurvedic medicine and understand it in India, we are not treating a symptom. We're trying to get down to the very basic root cause. And in this period of COVID-19, I've been talking to our medical friends over in India who are involved in this Ayurvedic medicine. And one of the things that they were charged with by the government is to try and find a way to boost the immunity of all Indians, to lift that immunity through whatever possible methods, including proper nutrition. We have to think of how can we become better as human beings. But we also have to address this aspect of we have a growing population. Is this big population going to be sustainable in the world of future healthcare, in the world of consumption, in the world of food? We have lots of questions to ask ourselves, and we have to dig deep to what is the right answer. Again, I'd like to hear from you on what your ideas are on this. I'm Neal Petersen. Till our next time.